Hello, resilient viewers. Today we're addressing a challenge that affects millions of older adults, chronic arthritis pain. Whether you're dealing with osteoarthritis, rheumatoid arthritis, or another form of joint inflammation, the persistent pain can significantly impact your quality of life. While medications play an important role in management, they often come with side effects, especially concerning for seniors taking multiple prescriptions. The good news is that numerous evidence-based, non-drug approaches can effectively complement medical treatment, or in some cases, reduce reliance on pain medications. Today, we'll explore 6 proven strategies to help manage arthritis pain naturally. These approaches focus on empowering you with tools to take an active role in your pain management. Let's begin our journey toward greater comfort and mobility. Strategy 1. Targeted exercise and physical activity. It might seem counterintuitive when joints hurt, but appropriate movement is one of the most effective ways to reduce arthritis pain. Why it works. It strengthens muscles around joints, providing better support and stability. Improves joint lubrication and nutrition through increased blood flow. Helps maintain range of motion and flexibility. Releases endorphins, the body's natural pain relievers, and helps with weight management, reducing pressure on weight-bearing joints. Best exercises for arthritis include water exercises and aquatic therapy. The buoyancy reduces joint pressure. Walking, low impact, accessible, and effective for most joints. Cycling, especially for knees since it's non-weight bearing. Tai Chi, gentle, flowing movements improve balance and reduce pain. Gentle yoga enhances flexibility and strength with arthritis-friendly modifications. Targeted strengthening, focusing on muscles that support affected joints. How to implement. Start slowly, with just 5 to 10 minutes a day, and gradually increase. Consider working with a physical therapist to learn proper form. Exercise when pain is typically lower, often midday. Apply heat before exercise to loosen joints. Use cold therapy after if activity causes increased pain. Listen to your body. Some discomfort is normal, but sharp pain means stop. Strategy 2. Heat and cold therapy. These simple, accessible treatments can provide significant and temporary relief for arthritis pain. Heat therapy increases blood flow, relaxes muscles, and reduces stiffness. Best used for morning stiffness or to loosen joints before activity. Methods include warm showers or baths for 15 to 20 minutes. Heating pads on low or medium setting. Warm paraffin wax treatments, especially for hands. Heated gel packs or microwavable rice or flaxseed bags. Cold therapy reduces inflammation, numbs pain, and decreases swelling. Best used after activity or during pain flares. Methods include ice packs wrapped in a thin towel, frozen gel packs, bags of frozen vegetables like peas that conform to the joint, cold water soaks. Safety tips. Always place a towel between the heat or cold source and your skin. Limit applications to 15 to 20 minutes. Check your skin regularly, especially if you have diabetes or circulation problems. If one method doesn't help, try the other. Some people respond better to heat, others to cold. Strategy 3. Mind-body techniques. Chronic pain isn't just physical, it also has emotional and cognitive dimensions. Mind-body approaches address these interconnected aspects. Why they work. They reduce stress, which worsens pain perception. Activate the parasympathetic nervous system, the rest and digest mode. Improve sleep quality, which impacts pain sensitivity. And enhance your coping skills, giving you a greater sense of control. Effective techniques include meditation. Even 5 to 10 minutes a day can help reduce pain. Deep breathing, especially diaphragmatic breathing, which calms tension. Progressive muscle relaxation, tensing and releasing muscle groups. Guided imagery, visualizing peaceful scenes or healing. Cognitive behavioral therapy, working with a therapist to reshape thoughts about pain. How to implement. Start small. Just 5 minutes daily. Consider joining a class or group for guidance. Use free online resources or recorded guides. And be patient. The benefits grow with consistency. Strategy 4. Weight management. For those carrying extra pounds, weight loss can significantly ease arthritis pain, especially in joints like knees, hips, and the spine. Why it works. Each pound lost reduces pressure on your knees by 4 pounds. Less fat means less inflammation, as fat tissue produces inflammatory chemicals. Improved mobility makes exercise easier. Weight loss can even slow the progression of osteoarthritis. Healthy approaches for seniors. Focus on nutrient-dense, anti-inflammatory foods like fruits, vegetables, lean proteins, and healthy fats. Practice portion control, not extreme restriction. Set realistic goals. Even 5 to 10% weight loss can bring relief. Combine dietary changes with gentle physical activity. And work with a dietitian, ideally one who understands senior nutrition. Important: avoid fad diets or rapid weight loss. They can cause muscle loss and nutritional deficiencies, especially dangerous for older adults. Strategy 5: assistive devices and joint protection. Using the right tools and protecting your joints can reduce pain during daily activities. Helpful devices include canes or walking poles, properly fitted to reduce joint load, jar openers, button hooks, and reaching tools to reduce strain on the hands, ergonomic utensils with larger grips, easier for fingers, braces or splints to support specific joints, shoe inserts or orthotics to improve alignment and reduce impact. Joint protection principles. Use larger, stronger joints like your forearms instead of your fingers. Distribute weight, use both hands to lift. Avoid staying in one position too long. Plan ahead, avoid rushing, which stresses joints. Keep commonly used items within easy reach. Where to find help. Occupational therapists can provide personalized guidance and tool recommendations. Strategy 6: anti-inflammatory diet. What you eat can either increase or decrease inflammation, directly affecting arthritis pain. Foods that may reduce inflammation include fatty fish, like salmon, mackerel, or sardines, rich in omega-3s. Colorful fruits and vegetables, packed with antioxidants. Olive oil contains compounds similar to ibuprofen. Nuts and seeds, for healthy fats and micronutrients. Beans and legumes, rich in fiber and plant-based protein. Whole grains, when tolerated, they support gut and joint health. Spices, like turmeric, ginger, and cinnamon, known for their anti-inflammatory properties. Foods that may increase inflammation include processed foods, especially those high in sugar and refined carbs. Red and processed meats. Items high in trans fats or high omega-6 oils. Excessive alcohol. How to implement. Make gradual changes instead of dramatic overhauls. Consider following the Mediterranean diet. It's naturally anti-inflammatory. Keep a food journal to help identify personal trigger foods. And stay well hydrated. Dehydration can worsen joint pain. Conclusion: managing arthritis pain effectively often requires a multifaceted approach. These 6 strategies: exercise, heat and cold therapy, mind-body techniques, weight management, assistive devices, and anti-inflammatory eating, give you powerful tools to complement your medical care. Remember, consistency is key. These methods work best when used daily, not occasionally. It's also important to work with your healthcare team. Discuss these strategies with your doctor, especially before starting a new exercise or diet plan. Physical therapists, occupational therapists, and dietitians can all offer personalized help. While arthritis may be part of your life, it doesn't have to define it. By actively using these self-care strategies, you can reduce pain, improve function, and stay independent and active. Next week, we'll explore 7 warning signs of hearing loss that are often overlooked. Don't miss it. If you found these strategies helpful, please give this video a thumbs up and share it with others who might benefit. Until next time, here's to your comfort and mobility.